So that is the you can say anatomic. Spastic is due to the spasm of the muscles, and psychiatrical is that when suppose there was some wound in on the eyelid, and when the wound heals up, then there is a fibrous tissue formation, and there is contraction of the tissues, contraction of the fibers, and due to that contraction, the entropion can take place. So this is how it works. Okay, so there are three types of the entropion. As far as anatomical or congenital entropion is most common disease in the companion animals, the Chow Chow, Kerry, Biru Terriers, Saint Bernards, English Bulldogs, Toy Poodles, Irish Setters, Doberman Pinschers, Great Danes. They have the congenital problem sometimes. Occasionally, it also affects the lower eyelid, but normally it has been seen in the upper eyelid. As far as spastic is concerned, usually associated with contractions of the articularis oculi muscles. Articularis oculi muscles, they are those muscles which are muscles of the eyelid. So due to that also, there is spasm of the muscle and the eyelid, it inverts inside. Then usually it is unilateral, but maybe bilateral. Then there is psychiatrical. Psychiatrical, I have told you just now that it may be due to fibrosis caused by some, when the wounds of the, eyelids, they heal up, there is fibrosis, and due to that fibrosis, there may be sometimes this condition developing. And also it may develop into the ectropion or entropion, any of them. Okay, then, the as far as the surgical correction is concerned, it is not, very big deal. It depends upon the underlying cause. We have to see the cause, and according to the cause, we have to do the treatment. So unless the cornea is irritated, where there is an anatomical or congenital, you can say congenital entropion. So we don't correct the entropion unless the animal is about 6 to 9 months of age or it has become adult. Because in certain situations it has been noticed that when the animal becomes adult, about 10 months of age, the entropion, if it is congenital, it automatically it covers it. It heals up automatically. It becomes that entropion no more remains there. So this is, so in those cases, we have to just wait. But at the most, if the eyelashes they are, touching the cornea, they are touching the conjunctiva, they are touching the sclera, and there's some watery discharge from the eyes, or some conjunctivitis, or there is, cornea is being disturbed. In that situation, we can put some temporary everting sutures. Temporary everting sutures we can make two folds of the skin, and then we can suture those folds of the skin so that the eyelid, or the palpebral border, it is drawn out or it is drawn away. So we can do that for the time being till the animal becomes older, and then we remove those sutures and we see that if the entropion is okay, no problem. If it remains there, then we have to do the surgery. Okay, so how we do that? Temporary vertex sutures. Sometimes condition gets corrected by itself when the animal is grown up. So this is how we do the everting sutures. That is, this is the entropion over here. You see the eyelashes; they are touching the cornea. Okay, and then what we do is we make two folds of the skin, as you can see it over here. So these folds of the skin, they are sutured together. So when you suture them together, so because we have folded the skin over here, so the palpebral border on which the eyelashes are grown, it will be drawn outward, as you can just see it over here. So now the eyelashes are here. First the eyelashes were inside. So when you suture them up, so this is a temporary procedure which is done when there is a congenital entropion. And because what happens is that if you correct the entropion in the childhood or when the animal is still growing, sometimes we may end up with ectropion, that there may be overcorrection. That is, the animal can get from entropion, it can undergo ectropion. So that's what we don't want. We can apply some temporary sutures like this, and when it is grown up, if it needs the surgical correction, we will do the surgical correction. Otherwise, sometimes it becomes okay by itself. So if surgery is needed, then what we do is that we remove a portion of the skin from there because we want to pull the eyelid downward so that the eyelashes they don't disturb the cornea or the conjunctiva. So what we do, we give a small incision, just below the part, which you want to pull down. You give an incision, and then a second incision is given according to severity of the case. Second incision is given below that, and then you remove the skin, piece of the skin from there, and after removing the piece of the skin, then we will suture it up. You can suture it with the simple interrupted sutures or with horizontal batters. The only thing is that the ends of the sutures, they should be small so that they don't irritate the conjunctiva. So as you can just see it over here, that is, this is the piece of the skin that the first you give this incision, then you give another incision. The ends of these incisions, they are joining with each other on either side. So this piece of the skin that is removed, as you can see it over here. So after removing of this, after the removal of the piece of the skin, we can suture them up. So because we have removed a piece of the skin, so when we suture it up, this eyelid, it will be drawn down, it will be pulled down, and the condition will be corrected. So normally what we do is we put the first two central sutures first so that proper orientation is maintained, and then we suture on this other side, as you can see it over here. First two central sutures we place, and then we suture of the sides. Then we can complete the suturing like this. So like this, because after removal of the skin piece, naturally this palpebral border, it will be pulled down, and the eyelashes will no more irritate the conjunctiva. As you can see it over here, this is the end. On the upper eyelid, the eyelashes are here. You can see, but in the on the lower eyelid, this over here, you cannot see the eyelashes because due to turning in of the eye palpebral border, they have gone down. So now what we will do, we will just remove, we will give one incision over here like this, okay, and then another incision going like this, and when then we remove the piece of the skin from there, and then we suture it. When we suture it, it will be pulled down, as you can just see it over here. So this is the suturing, and now you see the palpebral border that has come down. Or this is if there was some entropion over here, some entropion over here, some entropion over here. So on that side, you can do this surgical procedure. The other condition is ectropion. It is just opposite to the entropion. Ectropion is that when the eyelid is everted, it was an outward, you can say, eversion of the lower eyelid. That entropion was the inversion of the eyelid. In both the cases, there is conjunctivitis because when there is entropion, the eyelashes they will irritate the conjunctiva. But in ectropion, what happens is that eyelashes, the eyelid, that is, eyelid, they don't cover the eyeball properly, and the eye is exposed to the dust, dung, and the external environment, so the conjunctivitis can take place. That is, both the conditions, they have the same consequences. So a version of the eyelid ectropion, this is the exposing the conjunctival corneal surface. It may be congenital in Saint Bernards, American Cocker Spaniels, Newfoundland. It may be physiological due to fatigue. Sometimes if the animal is too much fatigued, sometimes the eyelashes they come down, the eyelids they come down. It may be paralytic, it may be psychiatrical also. That is due to the psychiatric formation after wound. There is contraction of the tissue, and the palpebral border that can be drawn outward. Or iatrogenic. Iatrogenic means you have done the surgery for entropion, but you have overcorrected it. You have removed a larger piece of the skin. So first it was suffering from entropion, and now it is suffering from ectropion. So this is the iatrogenic. If you do the overcorrection of the condition, then this is the ectropion congenital. It's a normal in the uh, in the spaniels and some other breeds also. This is also the ectropion. So for that, if it is too much, some this is a characteristic of some breeds also. But if it is too much, disturbing the eye, there is conjunctivitis, then we can treat it. And there are different methods to treat it. Now we will talk about that. This is also the bilateral atropia.
Excuse me, sir. The kids are waiting in the waiting room. Some students are still waiting.
Now I am not going to admit them. This is the last one because they just come at the end of the lecture.
Okay.
So if there is a surgical correction, for that what we do is, if indicated is persistent, there is no exposure of the eye to the dust, tongue, and environment, and the conjunctivitis is there, then we go ahead and treat this condition. It can be corrected by full thickness triangular skin piece or wedge section of the affected portion of the eyeball, or sometimes we do V to Y plastic. And that we'll just see how we do that. Triangular skin piece, what we do is we remove a triangular piece of the skin of the eyelid ventral to the affected portion. The size of the triangular will of course depends upon the severity of the atrophy or degree of atrophy. So there is a close, then we close the subconjunctival tissue with the C6070 suture material in a simple continuous manner, and then we suture the dermis on top of that. And the margins, they will be also, they will also, with the cruciate suture we can do it. As you can know, you just see it over here. This is the triangular piece of the skin which was removed, and then you first you close the conjunctiva, and then you close the dermis. As this will be very clear on this diagram. This is the triangular piece. There was an ectropion over here. What we do is then that this actually, so when you just put it over here, bring it down over here, so the condition will be corrected. You have removed a wedge resection technique. So here, in this one, it's a very good. I just found it on the net that this, one eye. You see, this eye is having ectropia, and this is the normal eye. This is you see the eyelid is down. So if you see, this is just a just by the diagram. That is, you have a wedge piece, and then you just cut it. Now you see the eye, it has become smaller. You can just see it again. So similarly, you can do it with the dogs also. That is, you remove a piece of the skin, okay, like this, and then you just close it. Now you see the eye has become normal. So it is, it is just, I just saw this picture, I thought I should show it to you. Then the other is the VY to plastic, V to Y plastic. That is the most fundamental correction method for the psychiatrical ectopia. It's a very good method actually. Okay. So what we do is we make a skin in CN. A V shape in CN is made and it is sutured into a Y shape. So what you will see it over here is that is as you see it over now, because this is the ectropion. Okay, now the eyelid, it has been, it is everted out. There is eversion. Now we want to put it back. We want to push it upward actually. So what we do is we make a V shape in CN, just under that portion of the eyelid which is everted. So this V shape, then what we do, we undermine the skin flap of the skin, then just like this. After giving the V shape in CN, you will undermine the skin flap. So now what we do is that now the V, this lower portion of the V, this is sutured with each other, and then this flap of the skin, this comes over here. As you can see it over here, that lower part of the V incision has been sutured, and then this, this tip of the flap, that will come over here. Now, because first it was here, so now we have moved it up. So when we move it up, the whole of the palpebral border, this will also move up. And this is how we do the V2Y plastic. It's a very good surgical procedure in which we can, treat the ectropion conditioning. That is, we make a V-shape incision and we suture it in a Y-shaped fashion. So by that, you can lift that, skin flap upward. So when it is lifted upward like this, and then the ectropion will be okay. Otherwise, we can sometimes what we do is we can remove a wedge of the skin from here, triangular, and after removing, then you can suture these edges of the dermis of the palpebral border. So that will also correct the ectropion, as you have seen in that video. Then sometimes we have the eyelid laceration, that the eyelids, they get torn or they get wounded, and sometimes there is no avulsion of the eyelids. That is a piece of the eyelid that separates, but it is still attached on one side now. So they usually heal very rapidly. So what we do is, now the point which I want to make it over here is that don't cut the eyelid. That is the everted portion. Sometimes what the people do, there's a small portion of the eyelid which is everted or which is hanging down. So they just go and cut it. So after cutting, what will happen? The eyelids will not be there to protect the eyeball. The animal will not be able to cover the eyeball with the eyelids in case of some untoward condition. So normally what we should do is we should always try to repair the eyelid laceration so that we can give a normal eyelid to the animal. Okay? So that can be done. If at all, we should at least try for the first time to save that eyelid. If it is not saved, if it dies, you can cut it at any time. But we should always try to save it. So suture, you can suture the eyelid, as you can just see it over here. I will show you how we suture the eyelid. You can use the horizontal matter sutures, and you can use the simple interrupted sutures. But when you use the sutures, be sure that the inner cut end of the suture does not touch the eyeball. It should be kept short. Or you can use simply the horizontal matter sutures with the knots away from the eye, so that then the cut ends of the suture, they will not touch the eyeball, they will not irritate the eyeball. As you just see it over here, this is eyelid laceration. You can just suture it like this. Or this is a very good case over here. This is the actual. This is the, you can see this was the lower eyelid. It was avulsed by some accident. Actually this is the cable, and it rubbed its eye against the barbed wire, and through that barbed wire, this piece of the eyelid, it just got avulsed. It is still attached over here. So what I did, that instead of cutting it, I just debrided it. After debridement, I brought it back, and it was sutured, in its normal place. So what normally we do is, that is this extreme end of this flap, that should be sutured first, from where it has a verse, and so that you can maintain, or you can give the normal orientation of the eyelid. So first suture you will put it right at the end, then you will suture the rest of the. So now you have, because it was attached over here. This was whole of the eyelid which was avulsed. So now you have given a normal eyelid to the animal, which will be able to protect the eye from dust and dung and from environmental stimuli. So that is how you can always suture the eyelid, and with very fine 30 or 40 suture material. Okay. So that is how we do the eyelid laceration. Then sometimes we have to do the lateral canthotomy. Lateral canthotomy means As you know, there are two cancers of the eye. One is the medial cancer, the other is lateral cancer. Sometimes in certain situations, to treat certain conditions, we have to open up the cancers, lateral cancers, or the lateral canthotomy has to be done. So for that, what we do is, suppose that sometimes that happens is there is proptosis. That is, there is prolapse of the eyeball, which you will see in the next diagram. So sometimes the prolapse of the eyeball, we cannot reduce it because it is swollen. So we have to do the lateral canthotomy just to give more space so that we can push the eyeball back into the orbit. So it's a temporary procedure actually used to increase the eye, of the globe and the conjunctival, fornixes during surgery to facilitate replacement of the globe after proptosis. Okay, proptosis means eyeball. Uh, there's the prolapse of the eyeball. So full clear skin is seen from the commissure to the conjunctival sac, cul-de-sac that is given, and after needful is done, then we can suture it closely. As you will just see it over here. This is the medial canthus, this is lateral canthus of the eye. So what we do from the lateral canthus of the eye, you go up to the cul-de-sac because there is a blind spot there. So you can just cut the skin like this. So you will be increasing the increasing the this side. So if the eyeball is out, you can easily place it inside in the orbit. And after reducing the eyeball after proptosis, you can again suture the this incision. So these are actually a temporary procedure just to aid in certain other surgical procedures. So that is the lateral canthotomy. That is not done independently. That is done only as an adjunct to the other surgical procedures. As we saw, if you remember, we do the episiotomy. We do episiotomy. So episiotomy, that's a temporary procedure. Then we just close. Similarly, lateral canthotomy is a temporary procedure. So after the needful is done, after suppose we have the proptosis of the eye, so after reduction of the eyeball, we can again close it. So lateral canthotomy, this is just you can say a help to the surgical procedure. Then there is proptosis, which we will talk about, that is the rest of the eyeball. So small breeds with normally bulging eyes, such as the pugs, they have the bulging eyes. They are very prone to proptosis. That is what happens is that you just give a jerk to the small dogs, the eyeball sometimes comes out. So when the eyeball comes out, so we have to replace it back into the orbit. When it comes out, sometimes it gets swollen. It gets hyperemic also. So we cannot put it back. So for that we have to do sometimes lateral canthotomy. When you do lateral canthotomy, then it is easy to put it back. Okay. So accidents, the sudden jerks. Sometimes we take the pug or the small baby with bulging eyes. We just shake them, in the hand. The eyeball sometimes comes out, as you can just see it over here. This is the proptosis of the eye or the eyeball. Note that these breeds, they are very common. Now you see the eyeball is out. It's just a small jerk, the eyeball comes out. As you can just see it over here also. This is the eyeball is coming out. So now this eyeball sometimes it cannot go inside, because it is hyperemic. So in that case, then we will what we will do. We will do the lateral canthotomy. That is, we give an incision on the lateral canthus backward, going up to the cul-de-sac, that is blind portion. When the side will increase, the entrance will increase, and then you can push this, eyeball back. And after we reduce this proptosis, or we put the eyeball back into the orbit, then normally temporarily we do the torsorrhaphy. Torsorrhaphy means we suture the eyeballs with each other temporarily for 2 or 3 days so that the eyeball stays there for a longer time and it will get set. Along with that, we'll give some steroid injections, steroid medications, steroid eye drops so that the inflammation it stops there. Okay, but this is the eyeball. It is out. This is almost dead eyeball. You really cannot do anything. In that case, we have to do the enucleation of the eyeball. We have to remove the eyeball from the orbit. That we will see in the next lecture on Thursday. So this is how we do the proptosis, our treatment consideration for the replacement of the eyeball. In case it is fresh, eyeball is viable, perform lateral conthotmy as an aid to easy replacement of the eyeball. Or then we perform tarsorrhaphy. Tarsorrhaphy means we suture the upper and the lower eyelid together so that there is a pressure is maintained on the eyeball and it remains inside. Okay, so keep the eyeball retained in the orbit till the inflammation subsides. So this is how we do it. In the post-operative care, systemic and topical antibiotics. Mostly we use those antibiotics which have the steroid inside because they are powerful anti-inflammatory drugs. So we measure to save from self-mutilation. You can put an e-collar that is necessary. Otherwise, the dog will scratch over the eye and the condition may become worse. And number two is if it is already dead, the eyeball is not viable, so then we have to do the enucleation of the eyeball if a replacement is not advisable. So as far as the enucleation is concerned, this is the lateral conthotmy. Again, you can see this is the eyeball of the lateral conthotmy or lateral conthotmy. This is the tarsorrhaphy. Tarsorrhaphy means you are suturing the eyelids together. Now, these are all the tarsorrhaphy procedures. First, you will close the lateral conthotmy, then you can do the tarsorrhaphy so that the eyeball remains inside. So after 2 or 3 days, when the inflammation subsides, then you can remove the sutures from the eyelids, and then it will be okay. So if you have to do the enucleation of the eyeball, we will study it in the next lecture. That will be on Dr. Asma. We should take it on Friday or on Thursday.
Yes, sir. I think Thursday is better. Last
The
week
same
we had
time
on
at
Thursday.
12:15.
Yeah, same
You can
time.
check it with your CR. What is her name?
Maliha.
Amelia. So you can check it with her. If you want. Because last time we took the lecture on Thursday
Yes.
at 12:15.
I think the
So
majority
that
is asking for Thursday.
If you whole of the class agrees, we will do it on Thursday.
Okay.
But you please let me know,
Okay,
then
sir.
we confirm,
Okay.
right?
Okay.
Okay, so now we will finish it over here. Any
Thank you,
questions you
sir.
have, or anybody? So these two conditions are very important, entropia and ectopia and this proptosis. They're very important conditions. Once it happened with me, I held a small dog with the bulging eyes, in my hands. I did just jerk it, and the eyeball came out. Immediately I placed it inside. Otherwise, it was a very troublesome for me, because the owner was also there.
Oh my God.
But it happened from me. Okay, so wish you all the best. We'll meet tomorrow, inshallah.
Okay, thank you, sir. Have a good day.